There he goes. They're taking him. There goes a little baby. This and future videos in the series document our experience trying to figure out if the cause of our cat's out of the blue illness and rapidly declining health in late April 2020 is related to the pandemic.
In the previous videos, we took our cat Waffle to the vet 3 times in the past 3 days, and on the 4th day, we attempt to use a new pet pillar to give him his medication.
There you go, baby boy. All right, let's just get him comfortable first.
Okay, can we do this?
All right. So we have to try to do that. Oh yes, good boy.
Good boy, good boy. All right, ready, Wops? Is that okay? You ready? Ready?
Water? Okay.
Is that good?
Yep, I think so. Water.
Ready, what? Oh no, it fell out. It's so hard. This might not work, guys. No. Okay, ready?
Okay.
Okay, Wops, come on. Okay,
Water.
you watch just a little more, ready? Sorry, buddy, sorry. Okay, gave him some water.
Okay. Oh. No.
Okay, is it in?
I
don't see anything.
I don't see anything on the. Okay,
Oh my
baby,
god,
no,
I'm sorry.
let's get you some tuna.
I'm sorry, Mom. I'm sorry. Oh my god.
Let's get you some tuna.
Oh my god.
Hey, successful insertion of pill. Now you're eating your tuna. Good boy. Good boy.
Oh my god, nice. It's so stressful. Thank god. My heart's beating. I think I need the IV bag for myself. Oh man. I can do this for 12 more days.
Okay.
Okay, I'm awake.
You're awake now?
Oh my god.
What's the next milestone for Waffle?
The next milestone is now we just monitor his progress. We just we just have to basically keep monitoring, make sure that he eats. If that's a great sign. Drinks his water. If he gets super dehydrated, we're gonna give him IV. But I think as long as he's eating and drinking and he's taking medicine, that's the best we can hope for right now. So I think the fact that he's eating is a good sign. If he wasn't eating or drinking, then we might have to accelerate to the hospital. But medicine check. He's eating now. His water, look, it's half full.
Oh my god.
Let me get a brand new one for him.
That's awesome, Wops. You're drinking your water. You're eating tuna.
He's snuggling with us.
He's snuggling with us. Oh, he still has some wheeziness, labored breathing.
He still has labored breathing, yeah.
When he purrs, it's labored. And he doesn't have a meow anymore. But I think on the whole, we're
Baby steps.
trending upwards. All right, good boy.
It's Monday morning. Seems to be doing okay. He ate and drank water last night, but his breathing is still very labored. Yeah. That does not sound good. So we're not noticing any improvement in the breathing. He is eating. He's drinking water. He is spending time with us now on the couch. The breathing is still very bad. So Krista here is going to call the cat doctor, see if we can talk to the doctor and see what she recommends.
Well, the cat doctor, this is Chrissy. How can I help you?
Hi, Chrissy. Good morning. This is Krista and Preston, parents to Lord Waffle. We're wondering if we could just talk to Dr. Penny and just give her kind of an update on his situation.
She is not in today.
Oh, because she mentioned to us that if we needed to hospitalize him, we should run it by her.
Do you think he needs to be hospitalized?
Possibly.
It's hard to say.
I'm going to text her now, and let me see if she answers me back, and then I'll call you back, okay?
Thank you so much.
You got it. Take care.
Bye.
Remember, when you go to, just call us and let us know what's going on.
Okay, perfect. We'll keep you guys updated.
Okay, thank you so much.
All right, thank you, Chrissy. Take care.
Take care.
Bye.
Bye.
Okay, so they spoke to Dr. Penny. Dr. Penny says that we should go to a hospital.
Oy, oy, oy.
Okay, I'll put my hand back. I'll scratch you. Alrighty.
Hey Shannon, we pulled up to the parking lot here to drop him off.
Okay, what's your pet's name?
His name is Lord Waffle.
Okay. And have you been here before?
This is our first time.
I'm going to put you on a brief hold. I'm going to call a nurse and come out to you, and then I'm going to pick back up and get your information, okay?
Thank you. All right, so we just got back from the hospital without Waffs. Just us.
That's all I have of him.
That's a memory of him. Yeah, it's a pretty crazy experience. So we drove to the hospital. They took him in. There he goes. They're taking him. There goes a little baby. And now we're just waiting. We had a chat with the doctor afterward. And basically, like, what did they tell us?
She said that he has a whole host of problems and they don't know what's causing it. She came up with an aggressive treatment plan and also a rather conservative treatment plan. And the doctor who actually needs to take a look at him is the internist, but she wasn't there today. And she'll be on site on Tuesday. The doctor who was on call today, she also mentioned that they would want to do, I can't remember. It was just so much, like, so many tests, so many different procedures. I can't even remember.
So this is a little bit of I don't want to say complicated, but we want to find out what's going on with him, and especially with this voice change. And I don't know if multiple things are going on. I don't know if he's got completely separate GI issues and something going on with his airways, whether it's his larynx. It's possible that he could be wheezing from lower airway disease. It's possible that he could be wheezing from something. He could have a little mass or inflammation, a little tumor, something like that, in his larynx. And I think that warrants getting like a laryngeal exam, and then potentially washing his lower airways if we really kind of want to get to the bottom of this.
They recommended that he's going to stay overnight. They're going to do their best to give him oxygen and pain medication, but then we're ultimately going to have to talk to the doctor tomorrow and just figure out how to kind of steer this in the right direction. I mean, we're both just completely emotionally drained and just overwhelmed. I mean, it could be this could be ongoing. This could also evidently be very, very pricey because we have to do so many diagnostic tests just to even find out what's wrong with him.
Probably going to be somewhere around 35, maybe to 4,500. And again, that's kind of, it depends on what she does and doesn't do, but that's just kind of a ballpark for now.
No, I mean, this has been a pretty crazy situation. Just literally happened out of the blue. 1 week ago from today, everything was fine. And then this only happened and escalated so quickly in the past, 3-4 days. And it's just, it's scary and you feel completely powerless. You just don't know what to do. It's in this hospital's hands now, so we're going to do our best to take it easy and hear what the doctor has to say tomorrow, and we'll go from there.
Yeah.
Hi, this is Dr. Kimmel. How are you?
Hey, Dr. Kimmel, this is Preston and Krista. Good morning.
Good morning.
Good morning. Thank you so much for calling back. I just wanted to talk to you about Lord Waffle, who fortunately is doing a bit better, is not having any respiratory distress currently, and is out of oxygen, breathing well. He's a very nice kitty, but I certainly know that based on his history and also the change in meow, that's really a hallmark of sign for laryngeal disease. And there are definitely some things that could be going on there that could be intermittent. I'm kind of worried about something that's intermittently obstructing the airway up there, anything from a growth to swelling to a polyp. So that's really the first place I'd like to look, and that would require a little bit of sedation, so a sedated airway exam. I would like to be prepared, depending on what we see there, to biopsy something if it's abnormal, or if I don't see anything abnormal, to look further while sedate. So to go down into the airway and behind the palate up into the upper part of the nasopharynx, as it's called, which is the area right behind the nose, just to look further and look for any evidence of disease there that's causing these signs.
Just after hearing what you have to say and what you think is the best course of action, I think that sounds right, and please go ahead.
Sorry, Dr. Kimmel, yesterday when we admitted him, one of your colleagues mentioned possibly doing a tracheal wash. After looking at him, do you still think you need to take that course of action?
If I see nothing obstructive in the upper airway, behind the palate, or in the upper part of the trachea, then I absolutely would want to do that to sort out if he has lower airway disease. But right now, everything is pointing to upper airway disease, and I wouldn't necessarily need to do the wash. But again, it's further down on the diagnostic workup that if everything else is looking negative, that is something that I would do to retrieve a sample. He's already sedate. There's very little risk in doing that. It's a tiny little fluid sample that we put in and then suction right back out. So again, I don't necessarily think I need to do that unless things come up negative elsewhere.
Gotcha. And then his change of voice is probably a result of the possible larynx kind of disease that you were alluding to earlier, right?
Exactly.
I see.
Yeah, laryngeal disease. One of the hallmarks in dogs, they get a hoarse bark, and cats, they get a change in their meow. You know, it's hard though. I mean, 15-year-old cats, just like some older people, there's a change in voice just from age, but this seems like an acute change, so it makes me more concerned that there's disease there.
I see. Okay, doctor, I definitely appreciate it. Thank you so much for everything.
You're welcome. Hang in there. We'll be in touch as soon as we can, okay?
Awesome. Thank you.
Okay, you're welcome. Okay. Everything went fine with the procedure, and he is awake and fine. His exam showed some redness and just a little bit of inflammation in the larynx, so nothing like a mass, thankfully. But that's probably why he lost his meow, is there's a little bit of inflammation there, but nothing bad. Looking at the back of the nose and the nasopharynx, it's also a little bit inflamed looking. Again, not that bad. I did go down into his trachea. It looked pretty okay. I did end up getting a tracheal wash sample because I feel like that's where we're probably going to get our answer. The fluid that we got up was kind of abnormal looking. It was opaque and even a little blood tinge, so I do think he's got some airway, lower airway disease going on. That's probably causing the increase in respiratory rate and effort. You know, we're obviously going to have to wait for some results, but in the interim, I have started him on antibiotic, and I gave him some inhalers to help with his breathing. He seems to be fairly comfortable, so I'm not adverse to trying to get him home sooner than later while we're waiting for the results, since they will take anywhere from like 1 to 4 days to get the results back. So as I get things back, I can certainly call you and let you know what we get and if it changes anything. But in the interim, he would just be going home on an antibiotic.
We're off to get Waffle from the hospital.
We got a call that he's stable, he's awake, and he's eating food. Our little boy. No pull-up, no biopsy, no tumor, just inflammation. We're waiting for more tests, but the good news is that we can see our little buddy again.
Yeah.
Off to get the car for the gazillionth time.
Oh my god.
5 days. All right, see ya. Here we are.
Turn left. Then your destination will be on the left.
Go to number 4.
Hi.
Yeah.
Hey. Thank you so much.
I love the name, by the way. Oh, buddy.
Hey, Waffs.
Alright, so the discharges should have been emailed to you guys.
Waffle.
If there's any questions at all, we're here all day and night, so give us a call, alright? Perfect, thank you so much.
Thank you
Have a good
so
one. Go
much.
home safe.
Thank you. Waffle. Waffle. Hey, Waffs. Oh, my boy. Oh, my boy. Oh, my boy. Hey, my son. Hey, my son. Oh, my son. I missed you. I missed you, buddy. Oy, oy, oy. Hey, my son. There he is. Hey, what?
Look at your little bear.
Oh, he's purring. A little bit.
A little bit.
Oh,
He's purring. He's so happy to
my
see us.
son.
He was licking his leg just a moment ago because
He's like, my leg's not handsome, guys.
he's got no hair over there.
It's a hip trend, Waffs.
And he got some medication, right?
Yeah. This is what he got. It's almost like Zithromax.
Azithromycin?
Mm-hmm.
That's your medicine, Waffs, to help with your lungs and potential bacteria in there. And in a couple days, the doctor will have the result of your tests. And we should also be getting the result for your COVID-19 test in a couple days too. And hopefully we'll figure out what went wrong these past couple days. Alrighty, let's go.